I am the greatest.
Hello, today we're going to take a brief discussion and talk about the disease Parkinson's. Parkinson's disease is a degenerative, progressive disorder that affects nerve cells in the deep interior part of the brain, the basal ganglia and the subthalamic nigra to be exact. This is going to be in the central nervous system disorder that affects approximately 1.5 million people in the US alone. The history behind it all is that Parkinson's disease has been around for a very long time. We can say ancient times for sake. In Western medical literature, it was described by a physician named Galen as shaking palsy in 175 AD. James Parkinson is jotted down as the discoverer, whom it was in 1817 when he discovered it. As you see with every disease, there's always some kind of or some sort of systematic effect, and in every 200 individuals, we will be diagnosed with the PARC. I made it short for Parkinson's disease because it's just too long to say Parkinson's disease every time. But men are twice as likely to get the PARC than females. There's no blood work or other lab tests that can confirm if someone has this condition. A majority of the time, your doctor will evaluate your symptoms. The symptoms, the symptoms often start out with a tremor here and there in one hand. Then you start to develop slow muscle movement, which leads into stiffness, then into loss of balance, and finally, when you go see a doctor, you'll be diagnosed with
mad snail disease.
I'm kidding. You can't get mad snail disease, but some symptoms that you would get if you did, get diagnosed with Parkinson's disease would be tremors, of course, which means just constant shaking, muscle fatigue, sleep, your daytime sleepiness, early awakenings, restless sleep, your whole body fatigue, you get dizziness, poor balance, you start to just fall, cognitiveness, amnesia, confusion, and difficult thinking. You start to lose your speech, you get impaired voice, a soft speech, and box spasms. You start to get different moods when you're diagnosed with Parkinson's. It's anxiety, you get a bunch of anxiety, and apathy. A lot of it has to go with your nasal also. It's a sense of smell or loss of smell. Urinary is a big one. Dribbling of urine or leaking of the urine. And finally, facial. You get jaw stiffness, reduced facial expressions. Also common is just blank stares, depression, difficulty of swallowing, drooling, falling, loss of sensitivity, and neck tightness. You also experience a bunch of weight loss. As a patient diagnosed with Parkinson's disease, you would hope that there would be a cure, but currently there isn't a cure for all PARC. But therapy and medications are used to treat the symptoms. There is walking, of course. Walking is always good for essential life. Dancing, and yoga.
When levodopa is used, only about 1% reaches the brain because 99% of it converts to dopamine found in the peripheral nervous system. By combining carbidopa with levodopa, carbidopa can inhibit the enzyme decarboxylase in the periphery, thereby allowing more levodopa to reach the brain. The addition to carbidopa to levodopa makes levodopa more available to the brain, so lower doses of levodopa can be given, and thus reducing side effects of drugs such as nausea and vomiting.
Current research is also being done on PARC. Parkinson's is caused by a lack of dopamine, so Parkinson's medications are aimed to replenish dopamine or mimic the action of dopamine. Medication has been a key factor now. Prescribed medical marijuana is now considered to be very useful to patients with PARC. There's also other drugs, of course.
Hi. Following the news that MPs are backing a call to legalise the use of marijuana for medical use, I wanted to film this video to show the effect of taking marijuana on my tremor. I have early onset Parkinson's disease, for which I've had deep brain stimulation surgery, which does a fair job of masking my symptoms. But for the purpose of this video, I've switched my DBS off. So what you're seeing here is my Parkinson's tremor with absolutely no medication whatsoever. I cannot tolerate the prescription medication for Parkinson's disease. They make me feel extremely unwell. What I'm going to do now is to self-medicate with some marijuana and then come back after 20 to 30 minutes to show you the difference. Okay, it's now 20 minutes since I self-medicated with approximately 30 milligrams of marijuana, which is just a small pinch, taken using a vaporizer. And you can see that my tremor has calmed down significantly. In fact, it's almost completely under control. The sense of relief is overwhelming. Apart from calming my tremor, there are one or two other symptoms that the marijuana has affected positively. Dystonia, which causes my right foot to curl over and is most uncomfortable, is lessened considerably. My voice feels stronger and it's easier for me to get words out. Thanks for watching my video, I very much appreciate it.